Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing our every other week COVID-19 update. Today's September 23rd, 2022. The Falmouth website's falmouthma.gov. Health@falmouthma.gov is our email if you need to email us, and our phone number is 508-495-7485. So there's 5,455 PCR. These are PCR tests, doesn't count home tests. Cases of COVID since the beginning of the pandemic. 23 for the week, so the week leading up to yesterday, go on Thursday, so the 16th-ish, 15th to the 22nd would be 23. The previous week was 59. Pretty up and down, but right around, some weeks are a little over 50, some weeks are a bit under 50. I'd say the average is all summer long has been around 50-ish cases of that's just, again, PCR. There's some multiplier, some number of actual cases that'll be higher. It could be 3 times, it could be 5 times, it could be something. As far as home kits and with the actual number of cases that are there. But we have PCR, those are the ones that we can track. Home tests don't get tracked. 8 probable, the probable and not the rapid tests, those are the ones you get at some place like a convenient MD. There were 8 of those over 2 weeks. The 14-day daily incidence rate per 100,000 for Falmouth was 17.8, which is up from 13.4, because there was more PCRs that week of the 16th. We had like 59, so in the week before that, this is a little lagging. See, 9.4 to 9.17. It's been a little lower since the 17th, so you see a lower week, but then this is capturing the week prior, so earlier in September, early to mid-September, 17.8, and what that incidence rate means is how many cases they would have per day, PCR positive, if Falmouth's population was under 1,000. Positivity rate is just the total number of tests given PCR and how many were positive. It's high, it's 9.21, 7.92. These numbers are high. It's also a little bit of a captive audience who's getting a PCR right now. If somebody goes to the hospital or somebody's ill or going to a doctor's, they may be more likely to be a PCR. The people that are just going to take a home test and be okay in 4, 5, 6 days, they're not going to show. So I think the positivity is going to stay high now that we've gone home test. It's pretty much been bared out that we've been well over 5 since the home tests came in. As far as our community levels, we bounce out of low and medium based on the number of, if you see on the far right, you see 10.8. That's new COVID admissions per 100,000 population over a particular time frame. We usually go 9 point something, we go low, 10.8, we go yellow. So we've been bouncing between low to medium, not because of our case rate. Our case rate is under 200, it's at 119, still a little bit up. And our number of patients in bed staffed with confirmed COVID-19 is 3%, and the trigger is 10. So we've always been lower on that number. And for the most part, been under a case rate for the county. This is the county, not Falmouth particular. The CDC does it based on county. Of 100,000 population, we would have 119.72 per 100,000 over that time frame. And so we are a bit above the medium, and sometimes we go into the high, low, medium, I guess is the way to look at it, pretty consistently all summer. If you look at these, this is hospitalizations and the number of hospitalizations. If you look at the far right at the top, you see that line is relatively stable, a little bit up, a little bit down since June-ish. And that's where we've been going high, slightly into the yellow or slightly into the green. And if you get one little, little blip, this particular one I'm circling, I don't know if you can see it on the screen, but right at the end, we're just above the 2 and 22 in September. You see that gets us to the yellow. And if it drops a little bit lower, it says, so it's really sort of consistent. Nothing like you see the big one in January of 22, where that was the big Omicron surge, where it was just a boatload of cases, or the Delta surge that you'd see back in 21. Those are much bigger surges for hospitals. So when we are arguing between yellow and blue and green, it's really sort of just small incrementals, hovering right around that threshold, and so. But you don't see a big spike at all since about June. It's been relatively flat. ICU is triggered downward. We'll see what happens when we do with the bivalent vaccine that's got the Omicron juice in it. So you can maybe see that get lower. Who knows? I don't know. Or, we could have a lot of cases because when you get into the fall and winter, that's when we generally have more cases. Statewide, 9,000 new cases. This is, again, this is PCR reporting. The state orders the town no home tests are not reported. So that's up from the last time I did this, was 60-something hundred. So that's a bit of an increase as far as PCRs. The trends are somewhat flat, like you saw just in the previous chart. Deaths are down a little bit. If you just happen to look at the line on the charts. So pretty stable summer somewhat. So MWRA numbers as well. I mean, it's, again, been pretty consistently in the same spot, some ups and some downs. It's on the upward trend right now, at least in the orange on the left is the southern part of the MWRA, which is the sewer system. This is checking wastewater for COVID, essentially. And so it's been relatively, consistent from the summer. Both of them, maybe a little more fluctuations in the northern. You see a little bit more up and down. It's pretty flat in the northern, on an upward trend in the southern. And if you go to the far left, you see it was way off the chart. That's what the Omicron surge of January looked like. So the viral loads is definitely much lower than any surge that we've had, especially the one we had in January. Incidence rates, we're on the higher side for this week. We had a couple of towns that are the same. We had Barnstable, we're a little ahead of Barnstable. Similar. So Barnstable was 17, Mashpee was 17, and Yarmouth was all 17. We were 17. We were closer to more to 18. Bourne was 20, and Orleans was over 20. And some of the towns are in the teens or lower. So the incidence, we're it's a high incidence rate, but again, it's based on PCR. So a lot of the healthier people that might not be at in a healthcare setting are the ones taking the home tests, and they're not going to necessarily show up. I think, when you look at positivity, you can look at, where is those tests being administered? And so we're all sort of in that same boat, going up. They're in the teens, most towns. Most towns are in the below 10, between 7 and 10, most towns fall into. That's been kind of where we've been all summer long, and I don't know how much useful this is because, it's not like back in 21 when everybody was getting a PCR and you had real good data, but, that's where we are with this. As far as getting boosters, the bivalent booster is what's out there. That's what we're recommending. So anybody over 12, we're recommended to receive one updated Pfizer or Moderna bivalent, bivalent's the new one, booster, at least 2 months after your second dose or last booster. All right, so you can do either. If you're 12 and over. Between 5 and 11, they want the monovalent or the original booster. In 6 months to 4 years, you should get just be your primary dose. 5 and older, all primary dose and a booster is recommended. Okay, so then they break it down to 5 and 11. They want you to do the monovalent. 12 and older, they want you to do the bivalent. Okay. Let's get into the next slide. You still go on vaxfinder.mass.gov. You'll still see pharmacies. There'll be some community health centers. There's one that they're doing out of Fort Seas. There's can be an MD. You just have to search around. There's, it'll take a little time to be, you might have to wait a little bit for it. Or search around a little bit just because they're switching over the bivalent. Not everybody just gets 1 million doses all at once. So, it'll obviously get easier and easier time, but from what I can gather, that you can still, you can get them. And so get your bivalent. Homebound, again, you still call the health department. We'll set you up. You can either email us at the health@falmouthma.gov or you call us at the 495-7485, and we will have the VNA mate reach out to that individual, whether it's you or a neighbor or a relative. A lot of times it's relatives that live out of town calling for a parent. We can take care of that. I guess I should have checked that out this week. Plenty of open slots. There has been, but I think it's been a little bit tighter with the bivalent. I just left that in by accident. The children under 3, it's a little bit more difficult because the world of vaccinations are done through pediatrician's office. If you're outside of your pediatrician's area or you're not at home or you're here and you're here for a month and you live somewhere else, it does get a little bit tricky because of liability, and a lot of the places don't want to do children under 3. So you have to look at VaxFinder for that. But anybody, you should be reaching out to your pediatrician's offices first in order to get a vaccine for children under 3. Testing's still around. You still go to the convenient MD. Some of the pharmacies may or may not do it. they're maybe scaling back a little bit, but Convenient MD still does it. Falmouth Hospital, as far as I know, still has their site there. Primarily, people are going to do home kits. And we're ordering them as they get close coded, or they get close to coming out of code. Some of the FDA has extended some of the shelf lives of these home kits, and we've been able to get some, so we're going to distribute some through the service center and senior center shortly. And so, but you also can buy them, you can order them. They're readily available. They're good. The only thing is about it is if you're symptomatic, take two tests, about 24 hours apart. That way, if you're negative and you had symptoms and you've got your relative or your child or somebody with it, and you've got symptoms, I mean, odds are it's probably that. So if you come out negative, that does happen with the home test. The false negative, you should test again the next day to make sure. But home kits are good because they help, and they definitely do help. Not nearly as accurate, though, as PCR. We do have a sponsored clinic coming up at the town. It's a flu and COVID. You could do both. Okay, it's October 14th from 3 to 6 at the Gus Canty. If you go on our website, there'll be a registration link. It's a online registration. Have your insurance card sitting there with you because they're going to ask that information, which makes it a lot quicker when you go get the vaccine. You can also, if you don't have that ability to do it, you can call the health department, again, the 508-495-7485 number. We ask just to do it in the morning between 8 and 11, before, somebody in the office might be out at lunch or something like that. That way we have somebody here trying to make sure we have staff ready for that. Monday through Friday, and then we'll go through with Color as the online registration system that the VNA and the county uses. You'll need to have your insurance card when you call. That way we can go through it. We're going to enter that information. We're basically going to be on the same website you'd be registering at to register you. So have your insurance card ready for that. That way we can go through it and get you registered. So we have that. And I think also the senior center has got a flu clinic coming up shortly as well. So in this, we'll have high dose for those that are eligible for high dose flu, regular flu, and then we're going to have the bivalent COVID. I don't know exactly if we're going to have Moderna or Pfizer right now. But I mix and matched personally, so I think that's not an issue for. If you have to have a certain one, I think they do ask you that on Color, so we may have both. But they do ask you on the registration which one you prefer. It's up to you. As far as vaccines, we did have an increase. We're at 337 for 2 weeks. You see 141 boosters, and we've been under 100 usually. So it tells me that the bivalent people are wanting the bivalent. And then we did gain 63 new vaccines and 133 second doses. So we're doing pretty good at that. Nice to see the 337. As far as the variants go, you see BA.5 has been the dominant one, and you see this BA 4.6 variant increasing, but not increasing to the same level that BA.5 took over BA.4, that took over BA.2.12 and BA.2 and BA.1 and all that. So it is increasing, but slightly increasing, not taking over as quickly that you would normally have seen in the previous variants since they've been tracking these. So still, again, BA.5 is still over 80% of the infections in this section. This is the United States. The chart similar for all areas. So as a review, there's still COVID around. Our numbers are high based on our PCRs. We don't know the total case counts. We haven't known the total case counts since home kits came. So you tend to use hospitalization. As far as hospitalization, we've been on the high end of low to the low end of medium for quite some time. This time we're in the medium. A couple of weeks if we could be low or mid-medium, I don't know. But that's kind of where our trend's been. It's sort of been right on that line, as I showed you before. The bivalent boosters are available, so you can register for those. It's got to be for those over 12, at least 2 months since your last, either booster or your primary series. BA.5 remains dominant. There are no mandates. There is a town advisory through the select board on in town-owned properties. There isn't, I don't foresee any of them going in that route, but you never know. I wouldn't say it doesn't ever happen, but we haven't been any mandates, restrictions or so forth for a while. So And I'm sure you all know that. So that's what my update is for this, and we'll do it again in a couple of weeks. And everybody take care. Thanks.